Welcome to the BC Renal Kidney Transplant Education video. A kidney transplant is the preferred choice for most people with kidney failure. In this video, we'll explore kidney transplant as a treatment option. We'll talk about the different types of transplants, the benefits they offer, and how we determine if it's the right option for you. We'll also cover ways to find a living donor and what to expect after the transplant, for both you and your donor. You might hear some new words in this video. A recipient is the person who gets a kidney transplant, and a donor is the person who gives one of their kidneys to help someone else. What is a kidney transplant? During transplant surgery, a healthy kidney from another person is placed inside your body. You will need to take medications for the rest of your life to make sure the kidney stays healthy. You will also need to meet regularly with your healthcare team. A transplant is an effective treatment for kidney disease, but it is not a cure. Why consider a kidney transplant? The main reason to consider a kidney transplant is to avoid the need for dialysis. For people who are not yet on dialysis, this means they could avoid the need for dialysis altogether. For people currently on dialysis, receiving a kidney transplant would mean they would stop dialysis. People with transplants can experience a more normal life than those on dialysis. They live longer, have better health, and have more freedom. Most kidney transplants last for more than 10 years. Types of transplants. There are two types of kidney donors: living donors and deceased donors. A living donor is someone who is alive and chooses to donate one of their kidneys. Before donating, the person goes through several medical tests to make sure they are healthy and that it's safe for them to donate. People can live long, healthy lives with just one kidney. A kidney from a deceased donor comes from someone who has passed away who had agreed to donate a kidney before they died. BC Transplant is the agency that takes care of all kidney transplantation in BC and makes sure that every donated kidney is healthy before it is transplanted. Wait times for a transplant can change from year to year. You can find the most up-to-date information on the BC Transplant website. Your care team can give you an idea of what the wait might look like for you. The benefits of a living versus a deceased donor. There are many advantages to having a kidney transplant from a living donor versus from a deceased donor. Transplants from living donors last longer, have a lower risk of rejection, allow better overall health, and can be done before you experience kidney failure. To receive a kidney from a deceased donor, you must be on dialysis before you are put onto the wait list. This diagram shows the steps of obtaining a transplant using a living donor versus a deceased donor. As you can see, the process is much simpler and faster with a living donor. Some people find a living donor after they start dialysis. In this case, a person on dialysis could get a living donor transplant and not have to wait for a deceased donor. Talk with your kidney care team about finding a living donor and the resources that are available to help you. The living donor process. Let's look at how the living donor transplant process works. After a person is diagnosed with kidney failure, their kidney function continues to decline, which is usually measured by a GFR of less than 15. If a living donor is available, both the donor and the recipient go through a series of medical assessments to make sure the transplant is safe for both. Once they are approved, the transplant surgery is scheduled. After surgery, both the donor and recipient will receive follow-up care to monitor recovery and kidney function. The deceased donor process. The process with a deceased donor is a bit different. After a person is diagnosed with kidney failure, their kidney function continues to decline, measured by a GFR of less than 15. A vascular access is created, and dialysis treatment begins to take over the work of the kidneys. The patient is then placed on the transplant waiting list until a suitable kidney becomes available. The wait time will vary. Once a match is found, the transplant surgery is performed. After surgery, follow-up care is needed to ensure the new kidney is working well in the recipient's body and to monitor their overall health. If a living donor is found after the patient has started dialysis, they would proceed with a living donor transplant instead of waiting for a deceased donor kidney. Am I eligible for a transplant? A kidney transplant is a complex surgery. After the transplant, you'll need to take anti-rejection medications for the rest of your life to help your body accept the new kidney. These medications are provided to you at no cost and are usually well tolerated. Before you receive a kidney transplant, your care team will assess whether it is a suitable option for you. If your team decides that you are not eligible, it's not because they don't want to give you a transplant. It's because they believe the risks would outweigh the benefits for your health and safety. The transplant assessment. Most kidney transplant recipients are under 80 years old. During your transplant assessment, your kidney care team will look at several factors, including how the surgery and follow-up care may affect you, any medical conditions that could impact the success of the transplant, and the support you have to help you stay healthy afterward. You may want to talk with your social worker about the issues you may face following a kidney transplant. Transplant is a possibility. What's next? If you are eligible for a transplant, you will be referred to a transplant team in Vancouver. Working with your local kidney care team, the transplant team will do a number of further tests to confirm that transplant is a suitable option for you. If these additional tests show that you're suitable for a transplant, the next step is to determine where your new kidney will come from, a living donor or a deceased donor. If you have a living donor, the timing of your transplant depends on your situation. If you are not on dialysis, your transplant can be scheduled when your kidneys start to fail, helping you avoid dialysis altogether. If you are already on dialysis, your transplant will take place once your living donor has completed all their tests and been approved to donate to you. If you don't have a living donor, you'll be placed on the deceased donor wait list until a suitable kidney becomes available. What does the surgery involve? Many people are surprised to learn that their own kidneys are usually left in place when they receive a new kidney. The transplant surgery typically takes up to 5 hours, and after the operation, you'll stay in the hospital for about a week to recover before going home. What happens after surgery? After your surgery, you will need to visit the transplant center regularly for the first month and less frequently as time goes on. Patients who live outside the Vancouver area will need to find accommodation in Vancouver for up to 3 months after their operation. When you're ready to go home, the transplant team will arrange your follow-up care at a clinic closer to where you live. Thinking about finding a living donor. There are many advantages to having a living donor for your kidney transplant, but finding one can feel challenging and may bring up a mix of emotions. Some people feel unsure about who could be a potential donor or feel hesitant to ask others. Others may not know how to start the conversation. It's also common to feel disappointed if no one has offered to donate or to worry about the donor's health and well-being after surgery. You may also feel anxious about feeling indebted or concerned about how the donation might affect your relationship with the person who donates. These feelings are completely normal, and your transplant team can help you work through them. You are not alone in this process. Your kidney care team is there to support you with information and tools to help you find a living donor and make your kidney transplant experience a success. How do I find a living donor? Finding a living donor starts by thinking first of people who are close to you, your family, friends, and neighbors. Start by talking to people, writing letters or emails, using social media, and recruiting friends to help spread the word. Donors do not need to be blood relatives or have the same blood type as you. Your donor does not have to live in BC. They can live anywhere in the world. Information for prospective living donors. For anyone considering becoming a living donor, it's important to know that the assessment process is confidential. You will receive all the information you need before deciding to donate. You will undergo thorough medical checks to ensure it is safe for you to donate a kidney. You can live a healthy, normal life with just one kidney. You can choose not to proceed with the living donation at any time. The transplant process for living donors. The living donor is the one who starts the kidney donation process. They must contact the living donor team at Vancouver General Hospital or St. Paul's Hospital to register for the screening process. If your donor isn't a direct match, they may still be able to donate through a national paired exchange program, which matches donors with someone else in need of a kidney. If your donor is a match, the surgery will be scheduled based on your situation. Transplant surgery and recovery for living donors. The operation is carefully planned in advance and will take place in Vancouver. The surgery to remove a kidney from a living donor is performed on the same day as the transplant surgery for the recipient. After the operation, donors typically stay in the hospital for up to 4 nights to recover, with support from the care team throughout their stay. Donors from out of town should plan to stay in Vancouver for 1 week. Most donors can resume light activities within about 2 weeks after surgery and return to light work after approximately 1 month. For full activity, including more strenuous tasks, donors typically need to wait 6 to 12 weeks. Practical help for living donors. Some donors may have access to private health benefits and employment insurance to help provide financial support. Most employers recognize kidney donation as a legitimate reason for missing work. Other programs are available to support living donors, including the Living Donor Expense Reimbursement Program, which helps cover costs associated with donation, and the Living Donor Mentor Program, which connects donors with experienced mentors who have previously donated a kidney. Finding a living donor. Keys to success. To improve your chance of success in finding a living kidney donor, it's helpful if you provide regular communication and updates to your family and friends. Invite donors to contact the Transplant Center for information. Find more than one living donor. Remember that finding a donor can take some time. Resources for patients and donors. There are many resources for both kidney transplant patients and donors on the BC Transplant, BC Renal, and the Kidney Foundation websites. You can also contact the kidney transplant teams at the Vancouver General Hospital and St. Paul's Hospital to discuss any questions or concerns you may have. Receiving a kidney transplant can be life-changing for someone living with kidney disease. Talk with your kidney doctor about whether a transplant could be an option for you and what the next steps might be. And remember, you're not alone on this journey. Your kidney care team will be there to guide and support you every step of the way.